So thank you very much for coming along here today to our self-advocacy workshop on communicating with health professions. And I'm Avril McLean. I'm a senior practitioner within Action for ME, and I'll pass over to my colleague who is doing the presentation today, if you'd like to introduce yourself, Karen.
Hello, I'm Karen. I work on the information support team. So if ever you send any inquiries in or you phone up, I'm one of the people that you'll be chatting to.
That's great. So how we're going to work today is we've got some ways of working just really for everyone to be comfortable, and that's just really like sort of ground rules about everybody in the workshop being treated with respect, dignity and confidentiality, and I hope that you can all sign up for that. There's some things that we won't be able to do today, and that is answer questions that are very detailed or that are specific to your personal circumstances with confidentiality. We don't want to do that. And obviously we can't give advice. So if anybody doesn't have any questions or anything that they want to say just now, I'm going to hand over to Karen, who will be sharing her presentation. You can put questions into the chat, and we also have a half an hour Q&A session for answering questions at the end, and that won't be recorded. We will check in with people partway through to see if people want a break where we can pause and then come back. So Karen, over to you. Thank you.
Hello. Okay, so I'm going to just try sharing my screen. Fingers crossed I get it right and you can actually see. Let's have a look. Okay, can everybody see that I've got the self-advocacy workshop up? Yeah, perfect. So I can't see you guys. I can see Avril, but I can't necessarily see everyone because I've got this on my screen. So please do shout up, like Avril said. If you've got any questions, don't feel like you've got to wait till the end. Sometimes it might be relevant to what we're talking about, and we can sort of answer it there and then. Otherwise, if not, we'll make a note and we'll have a look at it in a bit. So yeah, we're here today. Welcome to our session. We are here today to have a look at what self-advocacy is, with a focus on talking to health professionals. And we all know it's pretty tricky sometimes to do that, come up to lots of barriers and stuff. So in this session, we're hoping to explore what self-advocacy is and why it's important, have a look at potential barriers that you might face and ways that you might be able to overcome them. Explore ways that you can advocate for yourself when communicating with health professionals, and then hopefully share any useful information which might support you just to have your voice and your needs heard. We know sometimes they get lost with things. So what is self-advocacy? Does anybody have any ideas that they want to share on this, or? No, not a problem. I'm really sorry. I'm just turning my volume off on my phone. I forgot. Okay, so what is self-advocacy? In a nutshell, in a practical sense, it's finding a way to express your own rights, your needs, your desires, and just anything that you're needing at that moment in time. It's finding a way to bring them to life for the person that you are communicating with. So how do we put it in a way that makes them recognize that you are a person and this is your life? So how can you identify what it is that you need? How do you get a point of actually being able to get that across to them? Why is it important? Ultimately, on this one, you're unique and an expert about yourself and your life. Now, we all know that ME is really, really individual to each person who's got it. So you're the person that can say, this is what's going on. Organisations and other people sometimes hold the key to obtaining services and resources we need. So they might also make the decisions that impact on our life. Remember, though, that only you can make decisions that reflect your views and your wishes. Sometimes there's nobody else there to advocate for you. And it sometimes means that you won't necessarily get what you want, but it definitely opens the door to possibility. So it's all about putting you at the centre of your care, giving you the space to identify what you need and finding a way to express that. It can help you to identify what your personal priorities are, and take some control in a way that reflects your life and your needs, and hopefully empowers you to have a voice in within processes that sometimes feel like they can be outside of you. So healthcare, I think, is definitely one of those. Sometimes it's a little bit power imbalanced, or it can certainly feel that way. How do you advocate for yourself then? So what do we actually need to do? How do we actually do it? So good place to start is by prioritizing. So what is it that you need, you wish, or you desire? Understanding your rights can be really useful with this one. So what am I entitled to? And how do I exercise this? So is what you're asking for a right, or is it a preference? And communicating them to the professionals involved. So going back to prioritizing, breaking it down into manageable chunks can make a really big difference sometimes. Understanding your rights, so finding out what they are, just knowing where to look can be a bit of a hurdle sometimes. And then communication, how do you get things across in a way that is assertive and doesn't almost feel like begging sometimes, again, because of that power imbalance. So identifying your needs and your rights. What is it that you want? Where do you start? Where do you start thinking about this? So sometimes you might have a sense that you need something, but you can't quite pin down exactly what it is. I don't know if you understand what I mean. A good way, a good starting point, again, there's no right or wrong answers as to how you do this. It's very much about what works for you. A good starting point with it can be to think about, what do you want to achieve? So what is it that maybe is jumping out at you at that moment in time? Is there something that's a particular hurdle that you need to get over? Is there something you want to change or even stop? What difference will it make to you? We all know that sometimes when you're living with a health condition such as ME, the tiniest thing can just make such a big difference. So that can be something definitely to bear in mind. So rights and preferences, talked about this a moment ago. Just thinking about what's a right and what's a preference. Again, where do you start on this one? So this can help you to know when to kind of really push and insist that something is done, and also when to kind of back down and compromise a little bit. Sometimes it is that balance of give and take. Rights, let's start with rights. So if something is a right, it's something you are entitled to within policy, law, or contract. Knowing the legislation can be really tricky. Knowing where to start looking for them can be really tricky. So we'll look at that in a little bit as to where to start looking for it. If there is legislation behind it, it's sometimes a little bit more tricky for the professional you're talking to not give you that. So knowing this can be really important. As a general rule, it might be unchangeable in most circumstances. So because it's written into legislation, it's there, it's written, and it's pretty much got to be adhered to. An example of this is voting in an election. So everybody has the right to vote in an election. Obviously, it's up to you whether you do or you don't. Preferences. So this might be a one thing over another. So something we prefer and we can ask for, but nobody is entitled to, nobody's required to give it to us. So you don't have to. It's not an entitlement, even if a principle is at stake. So if something feels really important, that isn't necessarily the reason they would give it you. So an example of this is, we will all have a preference as to which political party wins, but we've got no way of guaranteeing that's going to happen. Sorry, just bear with me. I've just lost myself a little bit there. I think knowing this as well can be really good in helping you manage your energy as well. So if you know that something is a right, you might feel a little bit more like, do you know what, I can put my energy into that because I know that they should be doing this. Whereas if it's a preference, if for whatever reason your energy levels are a little bit lower, you might sort of think, do you know what, I'm just not going there at the minute. I'm not in the right place for it. So yeah, it can help with energy management as well on this one. Okay, so where do you find out what your rights are? Some of you might know this and might be able to jump on this straight away. Not everybody does. So just to give you a very quick overview. So Finding out, is the legislation which applies and relates to the issue that you're thinking of, can be really useful. So sometimes it's like a local one, so that could be a GP surgery policy, for example. It could be Equality Act, so that might be a countrywide. Up in Scotland, Charter of Patients' Rights and Responsibilities, so the Patients' Rights Act, and then Human Rights Act, which most of us will have heard of as well. A good thing to think about with this is if you don't know where it is, somebody somewhere will. So feel free to reach out. So like the team that I work on, this might be the kind of thing that we could help sort of say you have a right within, within this field. So don't be afraid to reach out and ask for support, just to find out what that is. So thinking about where are you now? So what support do you need? You've just worked out what the issue is, you've worked out what you're wanting, and you've worked out whether it's a right or a preference. Now what? Now where do you go? What do you need to support you? So that support could be support from family and friends, professionals, organisations. This might be resources and information. So within us, we've got Nothing About Me Without Me, which is our self-advocacy booklet. We've got This Is Me, which is a good guide for helping you get down who you are, what your needs are, and things like that. Things like the NICE guidelines, Charter of Rights and Responsibilities, health and social care standards. Some people will prefer to talk things through as well. So when you're trying to find these things out, think about what format works for you. Again, managing energy, managing health is something that it has to be considered as well. And if lots of writing isn't your cup of tea, doesn't work for you, doesn't work for the way you process things, you can pick up the phone, give us a call, you can talk it through, you can reach out to professionals as well. How's everybody doing? Is everybody okay?
I am.
Yeah, no worries. I'm aware that you're all
I just want to say welcome to Hannah and Fiona who have joined us. So thank you very much. There will be a recording. We can share that with you afterwards. Any questions, please put them in the chat. Anything that you want to ask us, please do that. If anyone wants to chip in with anything or an experience, please let us know.
Okay, so what I'm going to do now is have a look at just some common issues, and we can talk through some examples. I know we've only been going sort of nearly 15 minutes. Does anybody need a break yet? Because this is kind of where we get into it a little bit more, or do you want me to go on a bit and then have a break? Everyone okay? Okay, I'll keep going.
Nobody's made any comment in the chat, so I think we're okay so far.
No worries, I'll keep going. If anybody does, just give us a shout. Okay, so the common issues here. Oh, okay. The common issues that are showing up here. Oh, I'm really sorry. I'm pressing the wrong button here. Common issues that we get contacted about on the helpline. So this is a team I work in, the information support team. So when people get in touch with us, when it relates to healthcare things, often it relates to how do I get a diagnosis, really struggling, there's no services in my area, how do I see a specialist, my GP's done this, but I need a bit more. It might be questions about managing day-to-day symptoms, that's one that comes up a fair bit. Getting adjustments to care arrangements as well, so how do I get my GP to give me an appointment in the afternoon, because that's when I'm at my best. How do I get it so I see the same GP repeatedly, because having to explain everything every time is too much. Home visits is another one as well. We get asked about how to get home visits. So, and then a big one, getting people to understand ME, that can be really tricky. So yeah, we get a lot of questions. No question is a daft question. If ever you want to contact us, if you need to talk it over again, that's fine, it's not a problem at all. So I'm going to share an example, and again, there is no right or wrong way to do this. I'm just going to talk through one example of ways to do things. So a good starting point, getting a home visit from a GP. How do you go about this? Okay, so you get in touch with a GP. GP's response back to you is, don't have capacity to do home visits. Nothing in your notes that says you can't visit the surgery. Oh, right, now what? How do I get across to them that that this is what I need? Thinking about whether things are a right or a preference, that can be really useful. We're all aware that obviously GPs' policies are shaped by practice, as well as by bigger guidelines within the healthcare services as well. So thinking about it, GP will need to look at individual circumstances to be able to make a decision. So when they're thinking about that, they might think about general surgery needs, as well as practice policy, as well as the needs that you are saying that you need at that moment in time. For you as an individual, they'll need to think about, is the home visit clinically necessary? So is this something that is needed to maintain your health, to look after you at that moment in time? And what is the urgency of the need for medical attention? So we're all aware some things can be put on the back burner a little bit, other things need doing straight away. How you can support them to understand your needs. How do you do that relating to this question? So how do you get across what's important? So for example, it could be, is there a reasonable adjustment that they could make for what you're asking for? And is there a legislation? So things like the Equality Act might be able to support on that. And that can be things about looking at you as an individual, trying to understand the reasons for their decision as well. So asking them to explain, you're not out of order, asking them to explain why they can't do it. That might help you to identify if there are any rights that you might have, or whether it is a preference. And once you know that, you can make your request in a way which uses that knowledge. Do the surgery have all the information they need? So have they got up-to-date notes about you? Do they have copies of any medical reports that might have gone through? Is there a way that you can support them to understand that? So that could be things like getting across the NICE guidelines. They might not be aware that the new NICE guidelines came out and that graded exercise therapy wasn't included, was not advocated from now on, that sort of thing. We've got online training for GPs, things like that as well. Sometimes it might be useful to talk a situation through with your family, friends, or the professionals, just to see that you've got all the information you need as well to make it clear to them what your request is. So again, somebody like our team might be able to sort of say to you, try putting it across in this particular way. That might be useful. And sometimes just for emotional support, because this is really tricky sometimes. So making your request, make sure you've got all the information that you need, so you can gather it all together and hopefully have confidence that you've explored it to the best of your ability at that moment in time. Sorry, just bear with me. So how do you actually get it across to them? What is it important? Assertive communication can be really useful on this one. Does anybody have any examples of when they've communicated a particular way and it's gone well or gone badly that they want to share? No, not a problem. Is everybody okay? Does anybody need a break, or you all right? Okay, I'll keep going. So there's different types of communication. So when I'm talking about assertive communication, I am talking about communication which gets across everybody's rights. So it's listening, it's also being listened to as well. There's aggressive communication, so that can be things like somebody really talking over you and you're not being able to get a word in edgeways, or somebody telling you what they think should be done. There's passive communication, again, where you are the person who kind of sits back and is almost talked down to, but doesn't necessarily always feel confident enough to get across what you need. So assertive communication, so how do we do that in a way that respects everybody's rights? Active listening, you may well have heard this before. So that's listening that lets others have their say, so trying not to interrupt them. Easier said than done sometimes, definitely aware of that. Asking questions about what they're saying as well. So letting people have their say in the knowledge that you don't have to respond immediately. Sometimes you need a bit of headspace just to think about things, or just to process what they've said. That can sometimes help you to then go back to them and get a better outcome or better response. Acknowledging their point of view. So this shows that you've listened to them and heard what they're saying, even if you don't agree with it, which sometimes you won't. You can reflect back to them what they've said. So sometimes that's almost just kind of summarising what they've said. And that sometimes gives them time to realise maybe the way something might have come across and the way you've heard it. Obviously, we all interpret things differently. It can sometimes lead to more open discussions as well. And it might give you the space to acknowledge anything positive that they've already done for you. It doesn't always have to be a battle. In an ideal world, it ends up being you working together to get what you need, within the confines sometimes of a system that doesn't always work for you on that one. Hopefully it will help to build a more positive foundation on which you can work together. So again, even if you don't agree with their point of view, it can sometimes be useful to kind of reflect it back to them just so that they understand what you've heard. Say how you think and how you feel. It shows that you're taking ownership of your health and your experience. It's about you, ultimately. It can sound less accusatory if it's I rather than you in what you're saying. And sometimes it's not always possible. Sometimes you can clash up against people, but at least you have been honest and open about your side of things, and hopefully fingers crossed that leads to a more honest, open discussion between you. So yeah, it can be useful to own statements and lead by saying I rather than you did or you wouldn't. That can be really useful. And say what you would like to happen next. I think sometimes being really specific and sort of saying that I would like X, Y, and Z, they then are very clear about what you're asking for. It's an opportunity for you to express your needs, your wishes, your desires. Don't ever forget you are the expert in your ME. I know I said that at the beginning, but you are, and being heard is really, really important when you live with a long-term health condition. It's about empowering yourself to express your needs in a way that will support you at that moment in time, but also in the future as well. How's everybody doing? Anybody want a break? No? Okay. So this is just an example of how you might go about making your request. As I said, no right or wrong answer. This is just how I put it. We're all different. You might do differently. So making your request. So the one where they said we don't have capacity to do home visits. So an example response could be, I understand that, however, this is a reasonable adjustment to make to the service. I cannot access the service you provide in any other way and feel that access an appointment is clinically necessary because, and that's where you can put in why you think you need it. Health and social care standards say that one of the priorities is that my care and support meets my needs and is right for me. How can we work together so you can deliver your services to me since I can't get into the surgery? That is very clear, pushes across to them. You've got the health and social care standards behind it, which kind of highlights this is why it's important, this is why it's all right, and this is what I need. And you've also put why you think it's important. You have that appointment. The other example, there's nothing in your notes that says you cannot visit the surgery. So it sounds like the information in your notes is incomplete. I wonder if you could look at my diagnostic letters, clinic letters on file to update yourself on my diagnosis. ME is a fluctuating condition, so even if at times I may be able to go in, at this time I am unable to. Equality Act covers fluctuating conditions. You could look at the NICE guidelines for more information about ME, go to Action for ME's website, or even do a quick online training about ME that contributes towards your continued professional development, CPD. Again, that there gets across things like the Equality Act, so you've put in that you're aware of that, you put a request in, and you've also tried to give them information in a way that will hopefully support you. How's everybody doing? Is everybody all right? Anybody want a break? No? Okay.
Fiona said that there's a way that if you're not happy, people shouldn't be afraid to use the complaint system, which should also give negative feedback as well as positive. So there are time limits on complaints, and this is something that happens in our advocacy service because there is a waiting list. So it needs to be 6 months, and Fiona has learnt the hard way. Do you want to say anything about that, Fiona?
Wait a second. Yeah.
Yes.
Oh yeah. Yeah, it's one of these things that a lot of people don't realise that they can use complaints, because complaints aren't always the negative things, it's feedback. When I say I've learned the hard way, I've been pushed over timescales for health, social care and other services, because again, you're waiting for somebody else to help or somebody else to reply or something to do something, and it doesn't happen. And so when you try to escalate it, there's nowhere for it to go to because you're over timescales. And I think this is more and more people actually need to know that in all these conversations, which, you know, should always be good conversations, there's no reason why there shouldn't, you know, people shouldn't be pushed to the point that you're getting emotionally abused, basically. They shouldn't have to be there. Is that, you know, you do actually have some rights. And, you know, I see a lot of conversations saying, you know, like, you know, just, well, it's the doctors, and you know, it gets to the point you're very tired of doing their continuing professional development when you're ill and you're doing all the unpaid. I'm an unpaid carer as well. Let's say non-diagnosed ME myself up here. There's no, I mean, in an NHS Grampian, there's no diagnostic pathway, so you've got no really very little chance of getting anywhere. I think that's one of the differences. So yeah, just make complaints. I say it took me, I used to always give people a lot of time, you know, thinking, oh, you're busy, you've got other things on and but it was through my work through social care, the guy just said, you know, if you were in business, you'd have 28 days to reply. If you don't reply within 28 days, you escalate. You know, and it's just like, that's what you've got to do. You give people grace, and you just have to do it. But the difficulty being when you've got an energy limiting condition, not everybody has other people to fight their corner. And, you know, I think that's also something that charities have to be aware of, and try and be a bit more be transparent about the fact, you know, make it obvious what waiting times are, because it's not a reflection on what you're doing, because that's amazing, but people kind of need to know so they can get in there and try and have these conversations. So thank you. If there's anything else, I will come to it.
Yes, thank you very much, Fiona. And that's why we're trying to do the self-advocacy, because unfortunately at times our waiting lists may preclude people using our service to do this because they are out of the time limit by the time they get into service. So that's really great that you've raised this important point. Thank you very much.
Yeah, thank you for sharing that, Fiona. It's always good to put things in perspective. I can talk at you all day, but actually putting real world examples on it makes a massive difference, doesn't it? Anybody else got anything to add?
I think I might. I'm not sure how, sorry, not sure how up to date this is. I used to volunteer for Citizens Advice. I know the patient advice and support service runs through there. They deal with NHS complaints, and they've got a phone line you can call in, like even on the day or within a few days or something like that, and they'll be able to talk you through the process. So there's more than one place that you can go to, and I know that that is certainly the last thing I knew. Then the past team where there was somebody on the phone lines all the time. You might be waiting for a while to get through.
That's great. Thank you very much, Elizabeth.
Thank you. Anybody else? Would anybody like a break before we get on to the next example?
Halfway through, we've been talking for half an hour, so if you want to break or anything, speak up. If not, we'll press on.
Yes, please. I would commit murder for another cup of tea in this juncture.
Yep. We'll be back in 10 minutes. Thank you very much. See you in 10 minutes.
See you then.
So there's a link there, and I'll share it with people after the workshop if they don't manage to get the link now. So thanks, Karen, over to you.
Right, let's share this screen again. Oh, bear with me 1 second. Sorry. There we go, technical problems. I knew I'd do something wrong 1 minute. There we go. Hopefully everyone can see that we're about to look at explaining ME to professionals. This can be tricky. It can be tricky explaining it to the person that you live with, never mind to professionals. So in an ideal world, we know that the healthcare professional we're talking to might have some understanding of what we're trying to explain to them. They might be able to empathise with what we're saying, and they might have come across other people who've had similar experiences. Unfortunately, sometimes experience tells us it's not always the case. That doesn't always happen. So how do we actually get it across to them in a way that works for us and gets across what your ME is like? So things like, what is ME and how does it affect you? Again, you'd think that they would know this. But actually, GPs, for example, I've got to know lots and lots of different conditions, so they might not have come across it as often as we would like to hope that they have. That ME is not caused by you or by deconditioning, so you know you aren't experiencing what you're experiencing because you aren't getting out and going and doing things, and your body's kind of going. There is a real physiology behind it, and it's a real health condition. And things like certain treatments such as graded exercise therapy are not appropriate for a person with ME. Some of you might have come across suggestions that if you just did a little of this, then things will get better. And graded exercise therapy in some ways works on that premise. So the new NICE guidelines obviously recommended that it isn't recommended anymore. So what can support you? So limitations on time appointments. So you know, got 5-10 minutes max, and you've got to explain what you want, what it is that's affecting you, and boom, the time's gone. Also your energy as well, so a way to manage your energy. It can be really tricky. A good way of trying to put all of this into a pot in a way that works for you is knowing the guidelines, knowing the rights and everything that we've talked about previously, and that can help you to get across whether things are evidence-based, whether things are relevant to you, and get across your needs as well. Many people find it really quite difficult to try and get that across to a health professional because we're brought up in a world where health professionals are told health professionals are always right, they know everything, and they should be able to respond. In the real world, it doesn't happen like that, as many of you may have come across. But that doesn't mean that you should not hold them accountable and try and encourage them to learn about ME, learn about you, learn about how it affects you. And how best they can support you. There's a few health-related guidelines and things that can help you with this. So thinking about what could support you to get all of this across, it can be things like information. So cluing yourself up, guiding them to information. So this could be things like our website, general information about ME, there's information about talking to your GP. There's a few resources on there. So this is ME is a resource that helps you to explain your ME, how it affects you, what you like, you don't like, and how those things work for you. Evidence-based guidelines like the NICE guidelines, so you may be aware they got renewed, I think it was October last year, and so there's been a few changes made within that. For healthcare professionals and medical students, there are things like the Learn About ME podcasts as well. They're really good. They go through a vast amount of information and in an approachable way that will help professionals to sort of understand a little bit more. And then there's things like you may or may not have come across it, letter templates. So Action for ME, I've got one that you can send to your GP, and that can be editable. There's also one from the clinical lead in Scotland, very much about ME, and I think one of the big things on that was pushing and getting across that graded exercise therapy, the changes basically, you know, wasn't recommended anymore. That was definitely one of the things on there, and there'll be links to those at the end of the presentation, so don't worry about remembering them. So Sharing information. Again, this is just an example. So how do you share what ME is with somebody, and with a health professional in a way that is gets across that you know your stuff, and so should they. Again, one example I came up with, do it very much in a format that works for you, would be, I understand that you may feel my inability to do as much as I used to may lead to some deep conditioning, and so feel like graded exercise therapy may benefit me. The NICE guidelines recognise that ME is a complex chronic medical condition affecting multiple body systems and is a fluctuating condition in which a person's symptoms can change unpredictably in nature and severity over a day, a week or longer. For me, this means I experience XYZ, so you can put in what's relevant to you. NICE recommends that graded exercise therapy should not be offered to people with ME as it can make their symptoms worse. Obviously, you can see I've focused on graded exercise therapy there, just to give you an idea, but that one gets across. We've got the NICE guidelines behind it. We've got who you are as a person, and what you want out of it, and also we've got in there how it affects you. That's really important that they understand the person behind all of this. As I said, it's just an example. Your version might be completely different to that. There is no right or wrong. Remember, you're at the centre of this. So getting the best out of a situation. How do you get the best of the situation you find yourself in? Sometimes you will get a positive response. Sometimes you might come up against a bit of a wall. There's no right or wrong, and I'll keep saying that. Only what works for you. Nowadays, you've only got to do an internet search that will bring up a million different tips about self-advocacy, for example. You put that in and you'll get articles left, right and centre. Some people that works for them, other people it can be a bit overwhelming, so I've just tried to kind of pull it down a little bit. Again, not perfect, but hopefully we'll give you a path to go down. So preparing before you go into an appointment or a meeting or whatever it is you're going into, have a think about what you are asking for. You might already have done this early on, we touched on it, but have a think about what you're asking for and maybe the best way for you to do this. So for some people that will be written, other people it will be sat face to face, other people might need somebody, a friend, a family member to come with them. But we all know health professionals are busy, so the more you know what you're asking for when you go in, it can sometimes help them to understand, hopefully support you in the best way possible. Always remember, you will be doing the best for you at that moment in time. That's sometimes all we can do, be the best we are on that particular day. Put your request into a format which supports you. Sorry, I've just said that. So yeah, verbal, written, face to face. Don't be afraid to sit there with your little book and read it out if you need to. It helps. Sometimes it really does. And if that means that you get what you need to out of the meeting, then so be it. They can sit and watch you read notes. It's fine. Have some support with you. If you want to take somebody in with you, friend, family member, whoever, think about beforehand if you've got a little bit of time, even if it's just 5 minutes before the appointment, just to talk through, do you know what, this is what I'm going in for, this is what I'm asking. I want you to do X, Y, and Z. So do you want them to talk on your behalf? Do you want them there just to back up what you're saying? Do you just want them in the background for support? Just tell them, how you think they can be useful to you. And then listen to any explanations given by the health professional and don't feel you have to respond immediately. So by listening to the explanations, you might get a sense of why they are saying they can or cannot do what you're asking. That might then help you to go and find any legislation, for example, that might support you, or it might give you an idea whether what you're asking for is a preference, and therefore it might be something you might want to push at that time, but equally you might think, you know what, I'm not going there. I want to focus on something else instead. Always remember, you're allowed to ask for time to think about something as well. Don't feel like you've got to don't feel like you've got to give an answer there and then. You are allowed to say, thank you for that information. I would like to go away and think about that, and I will come back to you. That is well within your rights to do that. Keeps you at the centre of things. Now, we all know sometimes no matter what you do, you can go in, you could be super prepared, you could be having a really good day, get it all across, come out of the meeting and think, yeah, cracked that, that was really good. And you still might come up against blocks and setbacks. And they can be things like being told that there's nothing we can do for you, people dismissing your symptoms, your experiences and your requests, lack of appropriate services in your area, increasing your ME symptoms can be a block as well. And the feelings and emotions raised by advocating for yourself. It can be really hard work. It can feel quite lonely sometimes. Yeah, it can really push buttons. And I think being aware of that, that all of these can be part of any journey, recognising they can happen because of things that are out of your control, not because of something that you've done. It can be completely unrelated to something that you've done. Sometimes you're going to be able to prepare for them, and other times they're just going to challenge you and they're just going to push those buttons. Isolation and loneliness, I've just sort of mentioned that as well, so it can be quite lonely to go through this. So if things go a little bit wrong, does anybody have any examples of maybe when they've done something that they've had a block put in front of them that they want to share, or they've been doing something and it's just not felt quite right? No, not all right. So if things go a little bit wrong, one example, your health worsens or you start crashing. Has this ever happened to anybody? Yeah. Again, just a couple of ideas as to what you could do. You may well feel free to shout up if you've got any suggestions that I've not put on here. So refocusing your priorities and doing what's absolutely necessary. What is the most important thing to you at that moment in time? Then you've got the pockets of energy you've got, you can really, really focus them. If people in your life, such as friends and supporters, can no longer help you. So this might be considering sort of where you're at, what your capabilities are at that moment in time, looking if there's any other sources of support in your area, and sometimes that might be a professional advocate service, for example. Sometimes it's just going back to basics and looking at things like pacing again. We all know we can start really well and then real life creeps in and it all trickles away. So sometimes it's trying not to take too much on. Easy to say, hard to do sometimes. One thing that might go wrong, you might have had professional support and they might go, so funding cuts often happen across the areas as well, which you might have come across. If that does happen, it might be that you realise that that's just not something that's going to happen anytime soon. So you might be able to come back to something that felt more important to you again at that moment in time. I think the thing ultimately is sometimes there's things out of our control, and no matter what we do, you can't influence it. You focusing on what you can control can really just help you manage possible outcome, energy at that moment in time, your health, your well-being, because this can be hard work sometimes. And that's kind of where I'm going with this. I think sometimes when it comes to professionals, dealing with professionals, because you're within a system as well, within a healthcare system or a social care system, you can do everything perfectly, get across exactly what you want, and still come up against those blocks. And actually sometimes you've just got to pull back to yourself and go, do you know what, I need to look after me, because you are in the middle of all of this. So I've given you a lot of information here, obviously talking away at you, and I think remembering that looking after yourself is it's paramount. It's really important with a health condition. Also, when you are working with potential systems where somebody is making you work at their pace. So Fiona mentioned it before about health, about complaints. You've got 28 days to do things. It doesn't work that simply, does it, with MA? Fiona, I can see you've raised a hand.
Yeah, it's one of those things, you see, like accepting who you are and pulling back. Yeah, you have to, but from you're protecting yourself and letting the professionals know is to actually just even put a one-liner email in writing that that's what you're doing, because otherwise you get slapped with the beautiful non-engaging patient, client, whatever, and you are kicked to the curb, not even to the long grass, you're completely kicked out the circuit. So if you say to them, this is going, the other thing I would say, this is experience, is to actually, not everybody's familiar with these, it's like what's called communication passports. It came from the field where there's children and young adults with complex disabilities. One of the best examples is an organisation called PAMIS in Scotland. They actually have got a worker who just does this and produces what called communication passports. So basically it is creating in advance a passport saying what your communication strengths and weaknesses are, and really reiterating the fact that, you know, ME affects not just your physical health, but your ability to communicate. And a lot of professionals just do not understand that at all. They kind of maybe might get brain fog, but they don't understand the fluctuation ability in terms of communication. And I think that's what you've got to go on. And sometimes, you know, it's a sort of weird one, is trying to get through a GP. And, you know, if you're a young person with health difficulty, sometimes it can be easier because you can get referred to a speech and language therapist. Because I have to say, you know, in this journey, actually, a speech and language therapist got communication needs more than any other professional, and any health professional or allied professional. So that's something to kind of think about. But it's just, yeah, definitely put that one liner in it. I am not ignoring you. I can't deal with it. Not won't, can't.
Yeah, thank you. That's really, really good tips there, definitely. And like you said, sometimes it doesn't even need to be anything massive. It could just be, if you've asked them to email you, it could just be you've set up an auto response that just says, you know, can't get back to it at the moment, or like you said, they're more specific. If it is somebody like a GP, I'm not ignoring you because X, Y, or Z. That can be yeah, really important. So thank you, and the resources you shared is really, really good as well. Anybody else got anything to add? Nope. No worries, we'll carry on. So obviously I've thrown a lot at you, so I'm just going to go back to that thing of caring for yourself, because sometimes that is kind of where this ends up. And actually I think it's really important, whether you're having a really successful experience or whether you are hitting those brick walls. So what can we do? So how can you look after yourself? So accepting and adjusting to what is. So what is going on at that moment in time? Where are you? This is where you are, and that's that thing of what you can control. Your new normal might be hard. It might feel harder than it you know, it was 6 months ago, but it's really important for you to try and stay within the moment that you're in, and that can just help you to focus on the good things in your life at that moment in time, about focus on your ME and where you are and what you're trying to get to, and that might help in turn support you with emotions that come up as you're moving through this, because you will have a mix of positive and negative, and you'll have days when you feel great about something and days when it just feels like it's a bit too hard. So prioritizing what's the most important thing to deal with now. You do not have to take on 15 things at once. You can just take on one thing, and that's not just one issue. That could be, today all I'm going to do is write that one line sentence back to the GP. It doesn't have to be, I'm going to contact them and lay out everything I need, as well as contact housing because I'm having issues with that type of thing. That helps you to focus on what's really important to you at that moment in time as well. So managing feelings and emotions, again, there's a lot comes up out of this. So looking after yourself in that. Do you reach out and speak to people? Do you spend some time doing something nice? Do you go and just sit down with a cup of tea? We all know when you've not got a lot of energy, can sometimes again be those small things that make a difference. So building and maintaining relationships, personally and professionally, reaching out for support if you want to. You don't have to, but you might want to. They can be really good just in daily life. They can help you in the process of self-advocating, because it might be someone you can talk to about what you're experiencing. The professionals, it might be somebody that can help back you up a little bit. Even if they can't advocate, they might be able to write you a letter or just send you a copy of a report that they've got. That could be really useful as well. and sometimes they just give you a bit of a boost as to how you're feeling at that moment in time. Pacing, I know I mentioned it, and I know this is something that you might get thrown at you a lot, but it can really make a difference. And as I said before, in everyday life, it can get lost. So move at a pace that works for you. Don't be afraid to say, I need time to think about this. I will come back to you. You're allowed to have time to refresh. And build that sustainable routine, that manageable routine that works for you. And then obviously meeting basic needs every day. So eating, drinking, keeping warm, all the normal everyday stuff. So this is just some links about where to find information. You can have a look through when you want. It was just to give you a bit of a point to sort of source through. And that's kind of the end as to where we're up to. Does anybody have any experiences they want to share, any comments they want to add, any questions they want to ask?
I guess I don't know where everyone else is based. I'm in Edinburgh just now. I know there's an MECFS course at the Astley Ainsley. I was referred to it by the one MECFS specialist in Edinburgh when I eventually got referred there, like 8 years ago or something. And there was an emphasis on graduated exercise at the time. I'm not sure if there still is now, but there was I find the psychological help aspect much more useful, specifically about the managing the emotional aspect.